Good afternoon, everyone. I'm Neera Tanden. I am the president of this and CEO of the Center for American Progress, and I want to welcome you all to today's important virtual event. Before we get started, I just want to give a quick piece of housekeeping advice to say that live captioning for today's event is available at www.americanprogress.org/live captioning. Now, we're here today on the first day of the Democratic National Convention to talk about one of the most pressing questions challenging our country at the moment. Amid a pandemic that has scourged our country, one that has infected over 5 million Americans and counting, and led to the death of almost 170,000 more, we have to ask ourselves, how do we recover? How do we implement progressive policies that support a healthcare system that has been pushed to the brink? How do we support our schools and colleges? How do we support communities and individuals most at risk? And essentially, what are the steps we can take as a country to actually address this problem, to contain the virus and essentially beat it back? Something that we as a country have so far failed to do. America finds itself in one of the most extraordinary crises in our history, and the actions that we take right now must match the scope of that hardship. That is the task that stands in front of a potential Biden-Harris administration. Kemp has been at the forefront of this fight as well, and in the past 5 months, we have used all the tools and resources at our disposal to develop an alternative plan, one that actually helps people in the here and now, that protects them, that saves lives, and that also addresses the economic insecurity that people are facing, and creates a comprehensive public health approach to ensure every American is safe. We partner with leaders at all levels of government. We've worked with mayors, we've worked with members of Congress, but we've really been thrilled to work with governors who have been shouldering the burden of this crisis because of the lack of federal leadership by the administration. It's required bold leadership and a bold response. And so that is why we are thrilled to have with us today Governor Inslee as our keynote speaker to kick off the discussion and really kick off this week. With Washington being the first state to diagnose a case of coronavirus back in January, Governor Inslee has had to deal with this crisis a lot sooner than most states and a lot longer than many states. And so he's really set the tone, and his responsible leadership, his clear-headedness, his focus on science has been a role model for leaders all around our country. So we could not be more thrilled than to have Governor Inslee with us today. Governor?
Neera, thank you so much. By the way, let me answer the $64,000 question you have posed. What can we do to fight the COVID pandemic? And the answer to that is really easy. Elect Joe Biden and Kamala Harris to these positions. That's the most important thing we can do. I want to get that right off my chest at the top of the hour. Hey, thanks for having this discussion. We appreciate what CAP's been doing through this and so many efforts. We know that we see the handiwork of CAP in the Biden-Harris agenda items. You've moved the ball so far on the equity and justice agenda. We want to thank you what you're doing. And we thank for people for being on this call as well. You know, we have so many things to deal with. The fight to allow us to have the mail-in ballot that we're engaged in, and we will not allow Donald Trump to stop us from voting. The fight against climate change. We have many, many things to be engaged in. But you've asked me to make some comments about the COVID crisis. And what I'd like to do, if I can, I'm not an epidemiologist or a physicist or a chemist, but I do have some sense about how to connect what we're doing to the greater values that we have been fighting for the last several decades in this community. And at the outset, I'd like to frame this discussion around how I look at this moment. And you know, these are tough times for people. The anxiety, the uncertainty that we're all dealing with, they're difficult. And a fundamental question is how to think about this. And I think about it the way that Winston Churchill did during World War II, during the Blitz. People came up to him, asked him how he gets through the dark days when London was in flames. And he said, you know, these are not just dark days, they're great days. And they're great days because we have never had so much at stake. We've never had something that could unite us. We've never had something where all of us can make such a difference. And so I do think that these are great days facing the COVID pandemic and the challenges so that we can work together to beat this pandemic. So if I can, I'd like to suggest that there are 5 values that we need to bring to this effort that really need to underpin our strategy. Number 1, we've got to make decisions based on science. We've got to make decisions based on knowledge and data and the science that we have, rather than naked, a slavish devotion to ideology. Because when we follow ideology rather than science, we tend to blind ourselves to the things that can really set us free. And science is what has guided our state during this pandemic. Neera, you're right, we were hit first by COVID. We were hit hardest early by COVID, but we have never seen our state succumb to the huge ramp up that other states have experienced. And as a result of following science-based decisions, we have been able to keep, so far, knock on wood, a lid on this pandemic. Now, this is in contrast, of course, to the president's approach to this, which is sort of to thinking if you just cover your eyes and if you ignore the science and if you refuse to listen to the epidemiologists and the physicians, that somehow it will just go away. And that is what he has done. From day one, he has said this is a hoax. He has said that this would go away like the next Monday. And we know what happens when you blind yourself to science. You get bit by this virus. We have understood from day one a central fact about this virus, and that is that this virus has no legs. It can't walk, it can't move. The only way that it can transmit this disease is if in fact we're physically close to one another and we spread this virus through the air. And we've understood that central scientific principle that have led us to a relatively simple conclusion, although it's difficult in its application, which is we have to maintain some physical distancing from one another in an appropriate way. And then if we don't, the R0 number, the number of people that one person who's infected will infect, is over 1. And when it's over 1, the infection continues to spread. Now that's a mathematical principle based on simple math that the president has never been able to embrace. And you have to ask yourself, in today's situation, where we understand quantum mechanics, where we understand the genetics of diseases, to have a president who's ignored this clear science, what is the basis for that? And I think the basis for that is fear. Look, he doesn't think we can get on top of this. He's afraid of actually taking bold action. So we've made decisions based on science, and that meant that we had to take actions very early to reduce the interactions of people in physical interactions. And we did that early. The other part about science tells you can't wait on this pandemic. If you wait, delay is deadly. And we've acted early to some considerable success in our emergency proclamation, in our stay-at-home orders, in our decisions about when we allow social interactions. And this has had a beneficial impact. So science has to be our guide. Second principle, we know that we are all in this together and that all of us have a role to play and all of us are potential victims for this. And somehow to think that if you approach a public health pandemic as thinking that every person is an island is just going to be a recipe for disaster. So when we've made decisions, we've done it in wanting to take care of all the parts of our community, not just parts of our community. And the decisions that we've made from day one is realized that nobody can be thought of as a singular islet or island in this. Anything we do affects another person. Anything we do that allows us to be out and breathe on people, it shows that we have to act together as a unity. And this is something, again, that the ideologically driven decisions of the president have so endangered us, because that fundamental precept of his position is based on just kind of a selfish goal of taking care of number one and nobody else. We have understood we're all in this together from day one. And that's why we have done better in our multiple decisions. The third value is one of trying to always look for a way to reduce inequity, to reduce racial injustice. And so we know that racial injustice and economic inequity have been with us for so many decades, and it's been exacerbated by this pandemic. We've seen the huge racial disparity of impacts. For instance, in my state, we have 13% of our population are Latinx, but we've had over 40% of our victims who have the pandemic have been in this community. So in all the things we need to look at a way to increase racial equity and decrease economic inequity. That's why I just recently started a $40 million fund to take care of people who are undocumented workers. You know, undocumented workers do so much for our economy and our people. It's why we have been able to eat during this pandemic. We have people who are essential workers in the agricultural industry, and this pandemic has fallen unequally on them. So we have started a fund to help undocumented workers through this troubled time because they have not been eligible for unemployment compensation. We have started rules and regulations that protect people throughout the pandemic to reduce their exposure in the agricultural industry. And we've done things in our unemployment comp to protect essential workers so that, look, if you're in a vulnerable population and you have to quarantine, you ought to still be able to get unemployment compensation and not lose your job. We want to protect your job if you're a vulnerable person throughout this epidemic. So inequity is something we've got to put at the top of our list. The fourth principle and value that I think is really important, which distinguishes Democratic governors from Brand X, is that we understand that the health of families is the fundamental economic virtue and asset on how to grow our economies. We understand that having healthy families is not a way to, is not adverse to economic growth. It is fundamental to economic growth. And that is why we're proud of what we've done in my state and other Democratic governors. We have the highest minimum wage in our state. We have the best paid family leave. We have started the first long-term care plan in the United States. We've created the best financial aid package so that all of our students can get to college. We've created clean energy jobs big time because this helps families, and that families are the fundamental wellspring of economic growth. And that's why we believe that the best economic policy is to take care of our families so we can get our economy open again. This is something I'm proud to be a Democrat about, and I'm proud that the CAP community has helped advance all of these issues because we understand families are the basis of our economy. The last thing I'll notice in the value system is optimism. Look, we're the optimists here. We know we can get our economy going together again because we are optimistic in the battle against the pandemic. And we're not fearful of taking actions that ultimately will suppress the pandemic. Wouldn't it be great to have a president who's more interested in suppressing the pandemic than suppressing our votes? And that's the kind of president we're going to have with Joe Biden. So I just want to thank everybody for your efforts in this. I think that our value systems are the ones that are going to win this battle against this pandemic. We're going to make decisions based on science. We're going to make decisions understanding that we're all in this together. We're going to make decisions that allow us to decrease inequity rather than see it increase. We're going to make decisions based on family health as the wellspring of economic growth. And we're going to make decisions based on optimism. And when we do this, I believe that we are going to have a success. We are going to come through this. It's not going to happen tomorrow, but we're a tough breed, we optimists and Democrats. And I want to thank you for your support of Democrats all across this country, starting for Joe Biden and Kamala Harris. So my final comment, early to bed, early to rise, work like hell and organize. Let's go win some.
Thank you so much, Governor. Thank you for starting off this event, but also starting off this week. I really am so grateful for your optimistic leadership and, most importantly, your effective leadership. So with that, I'm going to say Thank you again to Governor
Georgiana.
Inslee, and I'm gonna bring up our panel.
All
If
right.
everyone,
Thanks,
if
Neera.
our entire panel can join us, that'd be great. Thanks, Governor.
Thank you.
Fantastic. So I see Ron Klain, Ashish, Dr. Ashish Shah, Representative Lauren Underwood, and I hope, oh, there's Randi. So I'm really thrilled to have such a fantastic panel to talk through these issues. I'm just going to introduce everyone, and then we'll go right into questions. It's really a tremendous honor for me to have this astonishing group of leaders here. And I'll just walk through the bios. Lauren Underwood is the Congresswoman for Illinois' 14th Congressional District. She was sworn in on January 3rd, 2019, and is the youngest African-American woman to serve in the House. She serves on a number of committees, but she's importantly, she was a nurse, and she has expertise in public health. So she's really a phenomenal person to be here today. We also have Dr. Ashish Shah, who's the director of the Harvard Global Health Institute and Senior Associate Dean for Research, Translation, and Global Strategy. He is also a practicing general internist and a professor of medicine at Harvard Medical School, and he's been a leading voice on the coronavirus response on many cable channels and throughout the country. Randi Weingarten is the current president of the American Federation of Teachers with 1.7 million members. It's one of the largest teacher labor unions in the country and really the world. And under Randi's leadership, the union has taken a number of steps to support education, transformation, and to strengthen the teaching. And she has been a leading voice in the country on how to protect our students in this moment of crisis. And finally, we have Ron Klain, who is a former White House Ebola response coordinator. Prior to that, he served as senior White House aide to President Obama and responsible for implementing the Recover Act. He also served as chief of staff to Vice President Biden, and has been also incredible voice on how to deal with the virus. So before we get started, I'll just say one more housekeeping issue, which is that we have set aside time for questions. So please feel free to submit any questions you have using the question tab on the side of your screen. We'll get to as many as we can in about a half an hour or so. If not a little less. So let me just jump into the panel and start off with you, Dr. Jha. Could you tell us, just give us an assessment of where you think the United States is right now in dealing with the pandemic and how we fare compared to other countries?
Well, Neera, thank you for having me on. And I think it's pretty fair to say we may have the worst response of any major country. You could argue Brazil's response is as bad as ours or worse, but when you're competing with Brazil for the worst response in the world, it's not where you want to be. And we didn't get here overnight. This has really been one mishap after another. It started in January with just denialism that this virus even existed or was important. The month of February, we largely flew blind. We had no testing capacity. And while the disease spread across our country, we had no idea. In March, when we first became aware of how bad things were, we were way too slow to respond. And that cost an enormous number of lives. In April and May, while the country was supposedly shut down, if you actually compare us to what happened in Europe, we didn't really fully shut down. There were large parts of our country where activity remained. There was mixed messages from the White House about what needed to be done. And then we opened up way too soon in way too many places and way too aggressively in June. And so June was the month where before we were ready to open up, we did. And July I see as sort of the month that began with initial denialism, a sense that no, this is all behind us. This is just much more testing. Deaths won't rise, hospitalizations won't rise. And I think really by the end of July, the data were just so overwhelmingly clear that we had messed up as a nation once again, that there really have been some changes. And as I look at the country today, what I see is the super hot zones of Texas, Florida, Arizona are starting to cool down. They're getting a little bit better, but we're still in really bad shape. We're still generating 50, 60,000 cases a day that we're identifying. Testing is actually heading in the wrong direction. We're testing fewer people now. There's a really good article about this over the weekend in the Times. About 15 states don't have a mask mandate, so we still have many states that have not put in simple basic public health measures. So that remains a challenge. And what I see, just to finish up, what I see over the next few months is more sort of challenges ahead and more muddling along. So let's talk about some of the challenges. I know we're going to get into this, but schools are going to open up. Many schools are open. Colleges are going to open. We are going to see more activity as we get into the fall. And what I'm worried about is that there will continue to be no real national strategy. And so what we will see is maybe a dozen or so states, Washington, Governor Inslee being one of them, really showing great leadership, keeping things under reasonably good control. But we really do live in a single nation. And so when things are bad in Florida, you can't really protect New York or New Jersey or Washington State. We're all in this together, as the governor said. And so until we have a change in federal leadership, or somehow miraculously a change of heart in the current national leadership, I really expect that this pandemic will be fought on a state-by-state basis. And a global pandemic is not the best thing to attack using 50 plus one different strategy. So a lot of difficult, I think, weeks and months ahead until we have a very different approach from the federal government. So let me maybe stop with that. And say again, thank you for bringing me on, and I hope that's a helpful level setting.
No, that's incredibly helpful. Randi, I'd love to turn to you because as Dr. Jha mentions, we have 50 plus one, we have 51 responses, if not more responses to this virus. And the people who have to deal with that are teachers and children and parents. When you have responses that are different, so varied across the country, and you have schools opening in places where the virus is still out of control. So I'd love for you to just share your perspective on how the virus is impacting our schools, our children, our parents, and really also, really incredibly, our teachers. Randi, are you muted?
Okay, is that better?
That's it, I can hear you.
Thank you. So, one of the things, I would say one of the only silver linings of all of this is that those of us who were born in the dinosaur age and had really been having a hard time, those of us who are, double Representative Underwood's age, we've had a really hard time figuring out technology. This has actually made us as adult learners learn these kind of things. But I would actually say, I wish, with every passing day, I wish we had Ron Klain dealing with this crisis. And I often rue, and I've never actually said this to him directly, but I've watched as the national president how the Obama-Biden administration dealt with Ebola and SARS and H1N1, and how we would constantly have a sense of where's the country going, the transparency, all the stuff that Dr. Jha just said about having the transparency, having a national plan, what was needed, constantly getting information from local areas, in terms of, like, I remember in Connecticut, we didn't have all the things we needed to make sure that the hospitals were ready. And Ron did everything he could to change that. There was the transparency. There was not denial, but there was action. There was a sense of confidence. None of that is here right now, which is now at a moment in August and September when parents and the public just feel like, well, teachers have figured out everything beforehand, they'll figure this out as well. And the fact that this time, in this unprecedented crisis, with this unprecedented lack of leadership on a national level, you can't figure everything out. So you have this tremendous frustration of no good choices right now in schooling going into August and September. So what is happening is that some of us, and you and I have talked about this at length, we tried from April on to figure out how to reopen schools safely to ensure that we didn't reopen in the same haphazard, chaotic way as there was closure. And I would say the only consistency has been the fact that none of the guideposts have been dealt with on a national level. I'll go through 8 of them very quickly. Number 1, we knew that in order to even consider reopening schools, you have to tackle community spread. And in some places it's been tackled, in some places it hasn't. I'll get back to that in a sec. You have to have a testing, tracing, and isolation process so that an outbreak doesn't become a surge. And it's not just about the science, it's also about confidence of people in schooling. So for example, if you have 1,100 kids in Cherokee, Florida now in quarantine, or you see the picture from Georgia of that, in Dallas, Georgia, of that huge, of that hallway with all these kids without masks going through, then there's going to be people in New York that are going to say that's going to happen here. So even if you could open in New York, they're now fearful that what happened in Georgia is going to happen in New York because it is a national issue. So testing, tracing, isolation. Number 3, I call it the big 6. So even if you can, and I've heard Dr. Jha talk about this as well, even if you've tackled community spread on a regional basis, you have to have those 6 factors that the CDC even says now are important to ensure that there's no spread of asymptomatic virus in a school. And that includes ventilation, cleaning, masks or other PPE, and social distancing, hand washing, and reasonable accommodation. That's the issues that if you don't have federal funding, how are you going to have the PPE? If you don't have federal funding, how are you going to make sure that those ventilation systems that don't work right now with windows that don't even work, open work? So just on the science, there's a lot of things that have to happen. But the other piece, and this is where I'll end, is on the issue of the inconsistency of information, the denials, the recklessness. Every time any of this happens, even a district like Newark, New Jersey, which I would say every single school would have been ready to reopen because they had figured out both lack of community spread and all the factors. But now the psychology of, will I be sick? Will my kid be sick? Is it safe? Because of the inconsistency of national leadership, I would say to you that at this point, most schools will reopen remotely, and ultimately, hopefully, with new leadership nationally, we'll be able to, over the course of this year, we'll be able to get into physical buildings. But at this moment, if you ask me, most schools in America are going to ultimately reopen remotely or open only in an isolated way in person.
So Representative, thank you so much, Randi, for that. Just for that, and maybe I'm going to mute. Some people are hearing the background. Representative Underwood, I'd love to ask you, we've just heard an overview of how the country's doing and the deep impact on schools and parents and families, because that all ripples through and ultimately our economy. I'd love to get your perspective on how we should be responding and why the House has responded as it has, and what are the stakes in the fact that the Senate has refused to pass a bill so far and the negotiations have really stopped.
Well, Neera, thank you for having me. So the House took action very early in the coronavirus pandemic. Let's go back to the CARES Act. We approved money for community health centers. There is funding to increase nutrition services, anticipating this rise in food insecurity that we've seen across all our communities. We funded Healthy Start, community health providers, right? That set the stage that we quickly followed up with something called the HEROES Act. We passed that legislation on May 15th. 3 months ago. And so when we think about the increasing number of cases, increasing number of deaths, right? We're over 170, I think, thousand Americans who've now died of COVID-19. How many of those have happened this summer? And so we funded the testing, the testing, the tracing, the treatment at $75 billion in that HEROES Act. We want free coronavirus treatment because we know that the threat of a high, unexpected medical bill keeps people out of our healthcare system day to day under normal circumstances. And in a pandemic, we want to get rid of those kind of barriers for folks. We have a lot of money in there, nearly $1 trillion to help our local heroes, right? State and local officials, first responders, et cetera, to make sure that our communities are able to sufficiently respond to this crisis. And then obviously helping the American people in their livelihoods. And so we've had a robust national conversation around unemployment insurance, but also the checks that people need. Those payments are critically important. Getting the money in the hands of workers is critical. And so as we think about moving forward, we need action right now. So I am thrilled that the House is returning this week to address the Postal Service issues. But we also know that the American people are looking for some relief. And so we need an economic stimulus. We need a healthcare stimulus. We need all of these things to help families move through. And then I have my eye towards future legislation. So we're fighting for a health force, right, to build up our healthcare workforce. We're fighting to end the maternal mortality crisis that we've seen for decades, but it has been just acutely devastating during COVID-19. And today just introduced a new bill to deal with vaccines. So there's a lot of work to do in the House of Representatives, and we are up for the challenge.
And thank you for that. I'm so grateful for your leadership and the expertise you bring to these issues as a nurse and with a person who's actually practiced in the public health sphere. Ron, I'd love to go to you and ask you, you have several different hats you wear and like several different lenses, one of which is the former Ebola czar for the White House. But you've worked on a whole series of issues, and you're also a critical architect of the vice president's plan to deal with the virus. So I'd love to get your sense. We've heard the leadership problem we have, the failure of leadership and why we are where we are because of the failure of leadership and a failure of a national plan. I'd love for you to, if you could share with us what the key components of a Biden-Harris administration response to the virus would be and why would it work effectively?
Well, thanks, Neera. Thanks for having me. And I also want to thank you and CAP for the outstanding leadership it's provided throughout this entire crisis. If you want to look at some of the best ideas for fighting COVID, they've come from CAP over these past 8 months. And it's really an amazing piece of work by Neera and her team. And it's a great honor to be here with you, everyone on this panel. And I want to thank Randi especially for her nice words before. Look, I think Joe Biden and Kamala Harris have made it very clear how they'll tackle this virus. And it starts first with science at the forefront of it, listening to experts, not denigrating experts. Vice President Biden said months ago that in a kind of a unique thing on election night or whenever he's declared the winner, the first phone call he's going to make is to Tony Fauci and ask him to stay on in his critical role, as opposed to the attacks we've seen on Dr. Fauci and other experts. And so when you listen to the experts, that means you're going to do things like a national masking mandate, which the vice president announced his support for this week with Senator Harris in their first substantive event after she was added to the ticket. So science, that starts. And then there's 7 specific things that a Biden-Harris administration would do. That begins with fixing our testing fiasco and adding to that contact tracing. As Dr. Job mentioned, we are actually moving backwards, not forwards on testing. We're going to test fewer people in America this week than we were testing 2 months ago. So we need to really get the testing thing fixed to where it's accurate, it's fast, it's affordable, and it's accessible. We're also going to a system of testing haves and have-nots that is just the exactly wrong thing we should do. And then, similar to what Congresswoman Underwood was talking about, Vice President's called for a national tracing corps of 100,000 new public health workers who could fight COVID. And then when we beat COVID, keep them working on things like opioids and other public health crises we have all over this country. So test and trace, that's the first step. Secondly, we need to ramp up our production of PPE. We need to protect people on the front lines. It's every one of those 170,000 deaths we've suffered is a tragedy. But a special tragedy in my mind is the 1,000 healthcare workers we've lost fighting this disease in the United States. Congresswoman Underwood used to do before she became a congresswoman. Nurses is the highest per capita death occupation in this country right now. Okay, that's horrible. We need to ramp up our production of gear to protect them and other frontline workers. We need to make more of it here in America to create jobs and have control over our own supply line. We need to have a science-based approach to vaccines and medicines. We need to, of course, get them as quickly as possible, but they need to be tested properly. They need to be safe and effective. And then we need to distribute them to everyone. The vaccine should be free to every person in this country, regardless of their status, and it should be widely available. That's our third point. We also need to then be part of a global solution to this. President Trump has said he's going to pull us out of the World Health Organization. Joe Biden and Kamala Harris will keep us in the World Health Organization. This is a global pandemic. We need a global solution. We also need clear guidance for businesses and our schools and help so they can reopen safely. You know, when I hear Randi talk about this, it's just so powerful. And, you know, I think all the time about the fact that we are sending teachers back into the classroom with no real guidelines on how to keep themselves and their students safe. And in a country where we often ask teachers to buy their own construction paper, to buy their own chalk, are we now going to ask them to buy their own PPE, buy their own masks, buy their own cleanser, deep clean their own classrooms? I mean, we don't do enough to support our teachers. We're sending them back to the classroom without the information and the safety they need. Same thing for our small businesses. We need to address that. And then finally, we need to focus on the communities that have been hardest hit. Those are our senior citizens and our people of color. This epidemic affects everyone in the country, but it doesn't affect everyone equally. And we need to understand that seniors have been particularly hard hit, people of color have been particularly hard hit. We aren't doing enough surveillance in those communities to find the hot spots, to protect people. We aren't doing the steps we need to take to really protect those people. So with that, let me just stop there and say that, you know, I do think that Vice President Biden and Senator Harris have the right plan here to try to turn this around. It will take time. As Dr. Jaw said, we didn't get in this mess overnight. It will take us time to get out of it. But I think if we go in the right direction with the right plan, we can get there.
Dr. Jaw, I'd love you to just respond in one broad sense, which is I do think that there's some thought in the country that the virus just happens and it's out of control and it's just a fact of life. But when you look at other countries, countries that, you know, not so dissimilar. In fact, as you mentioned, almost every industrialized country, including, you know, Canada, Germany, other countries are handling this much differently because of issues like national leadership and approach. So Liv, if you could just share with us, why are other countries doing better with the virus? Why did they have so many fewer deaths, so many fewer positive cases? So basically, they've been able to contain the virus. When they have an outbreak, they're able to recontain the virus. Just share your thoughts as to why that is the case. And you're so kindly muted, but that means you have to unmute yourself.
I'll figure this out just as this program ends. So there are lots of ways you could look at why pretty much every country has done better, but the single factor that really differentiates us from everybody else is denialism that has pervaded our entire approach. So first it was just a hoax, then it was the flu, it was never that serious. Now it's, oh, we're almost done with this thing, the vaccine is only 2 months away. By the way, one message, the vaccine is not 2 months away, and we are nowhere near done with this. We have more days ahead of us than we do behind us with this pandemic. And so we've got to kind of put on our seatbelt and get ready here because it's going to be a lot of hard months ahead. We are not done. But if you look at the different countries' responses, they're not just high-income countries. Vietnam, until about 3 weeks ago, hadn't had any deaths. And it's not because they're not close to China. They got a lot of cases, but they managed them effectively. And they took it seriously. Germany's strategy has been totally different strategy than South Korea, which has had a different strategy than Japan. but they've each had a strategy and they've implemented those strategies. So we could take a really aggressive masking strategy like Japan did, early and universal, with some testing, or we could do the South Korea, lots and lots of testing with some masking. The point is you need a primary approach and then you supplement it with other things. We've had none of that stuff. And so we find ourselves being really an outlier, again, right there with Brazil as the country that has continued to kind of flail on this. Again, one thing I do want to say, there are governors and states that have done a fabulous job. So it isn't everywhere in the country. I could point you to states, you all know them. They're the New Yorks and the Michigans and the Massachusetts and New Jerseys and others that have just largely handled this right, but they can't do this by themselves without federal leadership. So that's the big difference. It's denialism versus living in a reality-based world where the virus really does exist and it's a serious virus.
Representative Underwood, I'd love for you to talk about that as well. And just the basic question I have for you is, as in your district, how are you seeing this play out? Do you see that the lack of national leadership, is it affecting the virus? You're in a state that battled the virus early, but it continues to see some resurgence because of inflow from other states as well. So as from this perspective of your community and as a member of Congress, how important is a national plan, national leadership from your perspective?
You're right. We had early cases. Our governor took early decisive action. So we had a dual healthcare crisis and economic crisis. And it's been this way the whole time that COVID has been in the United States. And so we are very, very anxious for a national strategy. It is something that we could implement at any moment if we had the buy-in from our colleagues in the Senate who would be willing to pass a bill, if we had the shared values with the president and his administration to center a data-based, evidence-driven policymaking, but we just don't. And so right now, the two parties are so far apart in terms of viewing this as a novel, highly infectious virus that we need to contain. And so that division is prohibiting agreement on some of the basic things that we need to address, like, testing and making sure that we can get the machines repaired and get these reagents and get the swabs, to bleeding over. And as we talk about school reopening, which is top of mind in my community, most of our kids are going back. Well, we're originally supposed to go back in the next 10 days, and now either it's rolling or delayed or some kind of hybrid. And each school district is feeling compelled, like they are alone in making these decisions. They don't feel like they have the support, the anchor, the lifeboat in the federal government or their partners nationally, because they're not able to access these resources. And so that's why we are fighting so hard to bring the HEROES Act forward, to bring this next relief package forward, so that we can deliver for communities like mine.
Great. And Ron, we have a question from the audience, which is about the CDC and data collection, but I'm going to broaden out. So the question is about, has moving data collection away from the CDC affected available science? But I want to really broaden it out to you about relying on science versus politicization and the overall politicization of the CDC and how that has led to an inability to address the virus, because individuals are making these decisions. Schools are now making these decisions on their own about whether to reopen, rather than really trusting the information they're getting from the CDC, in part because some of the information from the CDC looks like it's been affected by politics. So how pervasive is that problem? And then how would you correct for that problem in a Biden-Harris administration?
Well, I think we have two problems. The first is that there's been a politicization of the information that people are getting, and then there's been a suppression of that information. And it's kind of the linking of those two problems, Neera, that's been especially pernicious. Let's go back all the way back to February. The first federal official to kind of really raise the most prominent red flag about this impending crisis was Dr. Nancy Messonnier, who is career official at the CDC, who is in charge of respiratory illnesses there. And she gave an interview on February the 26th, where she said, expect a significant disruption of American life. And the next day, basically, She was prohibited from giving interviews again. And we haven't seen Dr. Messonnier, even though she's the senior CDC expert on respiratory diseases, we really haven't seen her in public since then, since she spoke the truth. And we know the White House has had a battle with Dr. Fauci about his ability to speak honestly and candidly to the American people via all possible outlets, and a suppression of data and so on and so forth, and all these things. And so I think that's one big problem. You have to let people speak honestly and candidly. Vice President Biden's been very clear, and this is very much the way we handled the Ebola response, which is we put experts out there. They're going to tell people the truth. They're going to tell them good news and bad news. I mean, the Vice President's been very clear about the fact that we're in for some tough times as a country, and trying to pretend like we aren't is doing nobody any favors, okay? Mm-hmm. And so he said, I'm going to tell the truth, whether the truth's pleasant or not, and that means letting the scientists speak the truth. Now, the second problem we've had, as you say, has been kind of a corruption of the science, a politicization of the science, an effort to kind of take over the science, having the CDC issue guidelines about what to do in schools that I know Randy's very focused on, and then withdraw those guidelines, and then issue all of a sudden new guidelines that are just basically kind of a coloring book. I mean, basically just some very vague points without real clear guidance, right? And so I think that we need to make sure that the scientists are protected, that they have the ability to collect and disseminate data and information, and that their voices aren't gagged as they've been in this administration. I think all those would be the hallmarks of a Biden-Harris approach here.
And Randy, I'd love for you to just respond to that, because I think one of the things that we lose sight of is that the inability to trust the information from our government and from our president sometimes, and unfortunately not just him, the people who work for him, puts so much more pressure on parents. I mean, I can just say as a parent myself, I feel like I'm deciding these life or death issues because I can't trust what the president is saying and what issue guidance he's giving. And now we have schools making these decisions almost school by school instead of a kind of approach in which we have trust. So I sort of see this issue of trust as a lens that, the school issue and whether to reopen or how to reopen, it's a central parameter around this. So I'd love for your response to that.
So I think the trust issue is some of the most important issues. I think it's the most important issue we're facing right now. Plus, layering onto that, because of the denial and the liability issues, we're now seeing that most of these consequential decisions are being made school by school, which is really nutty. The people that have the least amount of control over resources or over any of these things are making the most consequential.
Or the virus. I mean,
yeah, exactly right. So I think that if you go back to both what Ron and Dr. Jha said, from the denial to the sorry, there's noises, but through the denial, through the doing things school by school, it's part of what's making a lot of this wrenching. I want to say one more thing. Part of what's wrenching about all of this is that we know that remote education does not work. And every teacher I know and every parent I know, it's not just because people need to go back to work. With all due respect for teachers, it is about we need to actually help kids, see kids, be in person with kids, make sure that they are in community again. That's what we are feeling the most pressure about. But I want to actually end with something that Governor Inslee said, which I think is really important, which is that if we can get to a new administration and get resources and figure out step by step how to create confidence that we're not spreading a virus in a school, in a place that has suppressed community spread, and in a place that has testing, then I think we're going to start seeing a real opportunity to get to equity. Think about having community schools and wraparound services and making sure that we are actually getting to kids who have learning loss. Think about what a new administration would do, bringing in all of the cable companies and saying, you need to actually make sure connectivity is like radio was during the FDR administration. So I feel a lot of hope that if we have a new administration who actually sees the virus for what it is, there's a lot of will on a local level to actually make this work for kids and to reboot the opportunity that I know we need to do for kids.
I think that point is a great point to end on, which is that if we actually suppress the virus, contain the virus, have a strategy, a national leadership to contain the virus, we can, I'll say it, build back better so that we're not just getting to, we're not just going back to what happened before, but we're improving schools, our economy at large. And I also really just want to say how much this conversation made clear that it's not that these events are happening. They are a function of leadership. Other countries are reopening their economy and their schools safely because they have contained the virus from at this point. So I am so grateful to all of you for starting off our week-long conversation on the ideas and issues at stake. And I really also want to profoundly thank you for each of your leadership in this moment of crisis for the country. You've all demonstrated how important it is to have voices that are speaking truth to power in this moment. So thank you very much, and thank you for our audience, and we'll see you tomorrow at 1. Bye, everybody.